Clinical research facilities have shown enormous commitment and flexibility over the last year, and throughout this video you will see examples of how CRFs have adapted to meet the needs and challenges of the pandemic.
University Hospitals of Leicester is a trust which is separated into 3 main sites. This presented a huge challenge for all of the research teams when the pandemic hit. It meant that all the individual and diverse specialities now had to work collaboratively to organise a cross-site response to the COVID-19 pandemic. The Leicester CRF has been created using a federated model, which meant we were able to work across the trust to support research in any speciality. We were therefore perfectly placed and experienced to spearhead getting the COVID urgent public health studies up and running. The CRF team helped lead, set up and run many COVID studies. We worked across all the different sites, recruited from all wards and specialities. Leicester University Hospitals managed to recruit 95% of all admitted COVID patients. We did what we set out to do, ensure all patients were offered the opportunity to take part in research.
We opened a new dedicated vaccine research centre as part of our CRF late last year to manage and deliver our growing number of COVID-19 vaccine studies. With a new facility, new staff and the global pandemic on our hands, this was no doubt a challenge, but like most of the NHS, we had to adapt, and we adapted well as a team to deliver this vital research, working at capacity during a global pandemic, all whilst prioritising the safety of our patients and staff. We exceeded our research capabilities thanks to the time and commitment of our volunteers taking part and the hard work of our dedicated team throughout the pandemic. I'm very proud to be part of a team that collectively played a key role in the fight against COVID-19.
Hello everyone! I have introduced individual boxes onto the department. Each child has their own box catered to their every need. Each box is different depending on the child. We have something to do, so something to make. We have Legos so they can build. We have sensory, and we also have items that are in their own packaging. I find this really, really useful. The children love it. We put something new in every single time they come, so that way they look forward to opening their box, and I think this is going to be the way forward from now on.
And I'm going to just introduce how we were able to work innovatively with our partners to ensure that essential CTIP trials continued to run throughout the pandemic.
Before the pandemic, patients would visit the CRF to collect their IMPs. But we now work together to deliver IMPs directly to patients' homes where possible.
Hi, my name's Andrew. I'm from a company called Royal Courier, and I'm here to collect out to the CRF today.
Patients will then be followed up remotely by video or telephone using our electronic patient record system.
The ethically approved Royal Devon and Exeter Tissue Bank was set up to collect research samples from routine care. This meant we could access leftover COVID-positive screening samples.
Recruitment was really high. People were eager to help.
When someone has a positive COVID-19 swab, you can generate a genetic code that is specific to that sample of virus and translates into something similar to a fingerprint. On a global scale, we can understand how the spread occurs, and importantly for me as a doctor, we can look at local outbreaks in a hospital setting. And we can track if the virus was likely to be contracted in the hospital or the community, which helps us to inform infection control procedures.
Where data could be shared, we work with other COVID study teams to speedily build up a comprehensive study database.
Helping others by participating in research made me feel like my voice was heard.
At the start of the pandemic, it was clear a senior administrator was needed to support the research nurses on the front line. Glasgow CRF introduced the role of Clinical Research Project Site Manager to support with study setup and management. There are a number of good qualities needed to be a project site manager, and this includes a high level of organisational skills, attention to detail, patience, a calm manner, the ability to work in high-pressured situations and prioritise with competing demands. This role has been a great success in Glasgow, and we now have 2 managers in post to continue to support the team in large, fast-paced clinical research studies. If you'd like to find out more information about this post, please view our poster in the Organisation or Administration category.
Welcome to Older UKCRF. We're here to talk about our National CRF Teaching Programme, which was born out of necessity when the pandemic struck. We were doing teaching with the Royal, we were sharing resources, we were working with each other, but when we couldn't visit each other and couldn't go on site, we had to migrate it all to platforms like Teams. Then we realised, why should we just do it amongst ourselves? Why can't we share it amongst everybody? And since then, it's gone from strength to strength. We've got 250 members of the team. We've had meetings that have gone across 31 different academic and NHS institutions and had at least 10 different sites present at the meeting itself. And we hope to bring it to a weekly format rather than 2 weekly in the future.
During COVID, what was the CRF's biggest challenge and how did you adapt to overcome this? Maintaining quality and safety while policies and protocols constantly changed was a challenge. We overcame these by using WhatsApp groups to signpost incoming changes, rapid response meetings to plan next steps, daily team huddles to brief staff on changes, on the ground, quality admin and education support. Thank you to our team and everyone across UKCRF Network. We couldn't have done it without you.